Can looking into a mirror make someone struggling with their body image feel better about themselves? A review of studies found that a new approach called mirror exposure therapy, where people observe themselves in a full-length mirror and talk about their bodies, may be the answer for some. And just explain, if you would, Dr. Judy, how this concept works.
Yeah, so mirror exposure therapy is an emerging treatment. We have some pilot studies on it, some smaller scale studies, but it does seem like it can help to curb some eating disorder symptoms. So the basic idea is that it is based in some concepts related to cognitive behavioral therapy, which is evidence-based. And in one version, the person will look in the mirror and they will describe their body not using negative language, because a lot of people with eating disorders will have some type of body dissatisfaction that seems very out of proportion. So they look in the mirror and they describe their body in ways that are much more factual, like you're building a body replica. So, you'll talk about things that are a little bit more structural versus I hate the way my arms look. In another version, you talk about the utilitarian portions of your body, how you're so happy that your legs can help you run. So for example, a person might look at their self in the mirror and say, my arms are about 4 inches wide as opposed to my arms are chunky. My thighs are strong and muscular. Again, something very factual. And then finally, they would say my hips are the width of my shoulders, like focusing again on the utilitarian pieces of your body.
Is this a form of mindfulness to sort of deal with your body shape and form?
Yeah, it's a form of mindfulness, plus it's a form of exposure therapy, because a lot of people with eating disorders, in many ways, they've actually been reluctant to look in the mirror, or whenever they do, it causes so much negative feelings like shame that you're teaching them to tolerate the distress of examining their body, but reframing how they think about it.
Is it better to do mirror therapy naked?
Absolutely. So we can utilize an anxiety hierarchy when we use this technique. So you start with yourself in an outfit that you probably like the way your body looks in it, and then you work up to it. You work up to exposing more and more of your body and doing this. And of course, you want to do this with the help of a therapist. You don't want to do it yourself because you might not be doing the technique correctly. And I will say it's contraindicated for certain individuals. So for somebody with body dysmorphia, and this is different from just the body dissatisfaction associated with eating disorders, but somebody who has true body dysmorphic disorder, where they look at an imagined flaw and they just focus on that flaw and they do repetitive checking, this would actually make that condition worse. I mean, it's all really about your frame of mind. And I think, unfortunately, with people with eating disorders, their frame of mind is always out of proportion with what's really going on. So somebody with an eating disorder might actually be a little overweight, but the way that they think about it and the fact that they put undue expectations on themselves and their body and relating that to their self-esteem. When people have eating disorders, oftentimes their self-esteem is completely based on what is on the scale that morning. So even if they lose or gain a pound, they either feel amazing or they feel terrible.
In a world where we body shame, in a world where quite frankly, we're always afraid because there is still the bullying. If you can look in the mirror and just remind yourself that it doesn't matter what anyone else thinks. You are your own best friend in that circumstance. But I think of this mirror therapy, and I think part of it is sometimes people continue to feel a certain way because they're actually unwilling to look in the mirror. But when you look in that mirror and you truly look at yourself, and you start to treat yourself as your own best friend, I don't know, it's a therapy that I know is effective, and this mirror therapy kind of forces you to do that.